Good evening. My name is Rachel Winthrop, and I am the Federal Affairs Liaison for the PTA caucus. What that means is we have Federal Affairs Liaisons for the APTA from every APTA chapter and section, and I represent the PTA caucus. So one of my duties is to make sure that we are staying on top of all the advocacy efforts of the APTA. And right now we're getting involved in some grassroots efforts with the upcoming PTA pay differential. So we wanted to make sure that you are aware of what's going on and how you can be involved. So this evening we have Justin Elliott. He is our Vice President of Government Affairs at APTA. And Kate Gillard is our Regulatory Affairs Specialist at APTA. And they're going to answer some questions for us. I've got some questions to start, and then I'm sure that some of you all out there have some questions as well that we can answer. So Kate, we'll start with you. How did we get here with this pay differential? Where did this come from, and how did we get to this place we're at now?
Yeah, thanks. That's a good question. It's nice to sort of set the table and get everybody on the same page as far as how we got here before we decide on what we're going to do about it. So as you all know, the PTA differential has kind of been cooking for a while now. It comes from the Bipartisan Budget Act of 2018. Now, when that law was passed, this PTA differential was really kind of added in the middle of the night after the bill was already decided. We tried to fight against it, but it was kind of a cooked deal. There's not a lot we could do about it. So when that law was passed, that law mandates that CMS implement a payment differential for services delivered in whole or in part by a PTA. Now, there's a lot of precedent for a payment differential. For instance, nurses and physician's assistants get paid at 85% of the physician fee schedule. In fact, in some cases, they only get paid 80%. So there is quite a bit of precedent for quote unquote assistants getting paid at a reduced rate compared to what the other professionals get billed. Now, that doesn't mean that we took this lying down. Pretty much since the moment that law has been passed, APTA has been fighting this on whatever plane we can. So for instance, originally, CMS interpreted that law as meaning the differential applies anytime a PTA is involved whatsoever. We took issue with that. CMS stated that's what in whole or in part means. And we indicated that, or fought with CMS, frankly. We had numerous meetings, sent them numerous letters indicating that that is just unfair. It doesn't make sense to penalize the mere presence of a PTA in the room. So we did succeed in getting them to apply a de minimis standard so that certain elements of participation by a PTA do not trigger the modifier. We got them to acquiesce on things like co-treatment, where a PT and a PTA deliver services together. The services should not be discounted when two professionals are helping you. So it really has been a long battle to get to where we are now with exactly how the modifier works, when it's applied, etc.
Thanks, Kate. So I know recently the physician fee schedule and the rule were released. So can you tell us what that looks like now that we've seen the actual rule?
Yeah, so the physician fee schedule, as you guys know, is the rule that comes out every year from CMS and sort of lays out what's changing in Medicare Part B for the following year. And this is obviously the rule where the PTA differential, the details are really sorted out. It's where we originally found out about things like de minimis and the modifier, et cetera. So before the rule came out, we kind of knew where it was going based on what they said last year. We had a good feeling that it was going to be, the modifier was going to be going forward on January 1st, 2022. And that is what the rule says. So CMS's proposal is to go forward with implementation of the differential. It wasn't all bad news, though. We did gain some more ground on application of the modifier. One of the last few issues we had been fighting with CMS on as far as application is concerned is certain instances where a PT furnishes enough minutes to bill a unit of service alone, and a PTA provides some additional minutes, but not enough to get you to the second unit of service. CMS had been saying that the modifier should be applied if it exceeds the de minimis standard. But we thought that was kind of ridiculous because what it was doing is penalizing clinics for delivering more care. Because if a PT delivers enough minutes to bill a service alone, a few additional minutes by a PTA shouldn't result in reduced payment. It doesn't make sense to pay less for more care. So we did get CMS to acquiesce on those issues. We're very happy with the changes they made as far as application of the modifier, but we are not happy with the fact that CMS did not take the mitigating steps we had been encouraging them to take. So we have been historically advocating that they, exempt rural and underserved areas that employ a higher rate of PTAs, and also have harder to find medical services in those areas. So if you've got problems with patients getting access to service, you shouldn't be imposing a payment reduction on those areas. It's hard enough as it is. You're going to put people out of business. You're going to make a bad problem worse. So we had been hoping CMS would take us up on that, and they didn't. But we also had been advocating for supervision change. As you guys know, PTAs in private practice are under direct supervision, but everywhere else it's general. CMS needs to take steps to make that more equitable. Now, while we didn't get that, CMS did say in the rule that they are potentially considering making permanent their temporary policy of what is called virtual presence, direct supervision through virtual presence. So as you guys know, general supervision only requires you to be available by a telephone call. Direct supervision through virtual presence requires you to be available by an audio-visual call. So like phone call versus FaceTime. We want general supervision, but if direct supervision through virtual presence is all we can get, we'll take it. But overall, the rule had some good things and some bad things. We won some points on the CQ modifier, but they didn't take the overall strategy we had been hoping they would.
By August 13th, will be formalized. It will be an alternative.
I was going to say, one of the things that, with Kate is talking about is that's one of the reasons why getting comments to CMS is so critical now more than ever. And there's a deadline that's coming up for folks to submit comments to CMS. And Kate, I know that this is something that you've been working on in terms of template letter, and it's easy. It's easy to do it. It only takes a few seconds. And I think that that's important for every both members and non-members, family members and friends to submit these comments to CMS on this issue.
So you bring up a very good point, Justin. I know we have lots of strategy planned on the regulatory front and on the legislative front. Our APTA advocacy network is fantastic. I mean, they stay on top of these issues and try to make it very easy for us as members and non-members to be able to take part in grassroots efforts. So Kate, do you want to explain how the strategy is going to work on the regulatory front with CMS? How can we get things going here?
Yeah, so as I kind of alluded to, our strategy towards CMS is we're asking for three things. First, they need to delay the whole thing. The PTA modifier is confusing. It is, it's hard to understand even as it is, but the fact that CMS is still making changes right now that aren't going to be finalized for another couple months, and then they're going to have, folks in the field are going to have like 6 weeks to figure out the entire policy and implement it. We need to take a step back. We need to give folks more time to recover from the pandemic. We need to delay this by at least 1 year. We should not have a PTA differential in 2022. Second thing we're asking for exempt permanently from the differential rural and underserved areas. Like I said before, these regions tend to rely more heavily on PTAs. Patients already have trouble finding a clinician, and these areas should not be subject to a pay cut. We know CMS has the regulatory authority to do that. We actually consulted with a law firm here in Washington, D.C. to get a legal opinion on whether or not they can do that. And we believe they can do that and they should do that. The third thing, what I talked about earlier, changing supervision standards, the fact that physical therapist assistants in private practice are the only ones subject to direct supervision is just silly, frankly. Let's have uniform policies across all settings under Medicare, unless your state scope of practice requires you to have a higher supervision level. CMS should not be telling you that you have to go under stricter requirements than your license does. So those are our three asks. Delay, exempt rural and underserved areas, change supervision requirements. We believe that CMS alone can do all of those things today. And that is why the number one most important thing you guys can do is submit comments to CMS. Because they don't need Congress to do this, we can overwhelm them with comments and we can get it done today. We've already got about 1,000 comments submitted to CMS by APTA members. We need to get 20,000 comments submitted. So we have tried to make this as easy as possible for you guys. If you're an APTA member, you can go to apta.org/advocacy and check out our Regulatory Action Center. We have 2 comment letters there for you to use. One is specific on this issue. It goes into a deep dive on the 3 asks, the delay, the rural and underserved, and the supervision, because we wanted to give you guys the opportunity to submit a very detailed, very specific comment letter to CMS. The second comment letter we have addresses all of the issues that we're facing with the physician fee schedule, things like telehealth, things like the payment cut. But it does absolutely include the PTA differential in that letter. There's not a single thing you can send to CMS that doesn't include the PTA issue. I want to make that clear. Every advocacy item that we have available to members includes this issue. We've just also given PTA issue its own special extra detailed letter. You can submit either letter you want. You can submit both. The other thing you can do, tell your friends, tell your coworkers, anybody who's not an APTA member, doesn't even have to be a PTA. It can be your mom. It can be your neighbor. Go to our Patient Action Center. That is open to anyone. You don't have to have any sort of login. And that with that, you can submit a letter to CMS opposing these issues. And you don't have to be logged in. We want anybody and everybody to send that letter. So you can tell your friends to submit comments because, like I said, I'll say it again, CMS can do this alone. We don't have to get Congress involved. We will if we have to. But if we overwhelm CMS with comment letters, then we could get a resolution without needing to go to Congress. But if we need to go to Congress, I know Justin Elliott's got it covered, and he can talk about the strategy we've got going on the legislative branch of government.
Yeah, and so, as Kate said, we're pushing really hard with CMS. The clock is ticking. We need to overwhelm them with comments because we got to go on the record to show that there's overwhelming support of patients and providers and the public pushing CMS to make these changes via the final 2022 rule. Now, a couple things to note that this differential, it applies to Part B Medicare, so outpatient. Now, folks may think that, that just applies to private practices. If you bill Part B, this applies to it. And it also applies to our friends in the occupational therapy field, so OTAs as well. So it's PTAs and OTAs. And so we've got to get as many comments on the record with CMS on this issue, because here's what we need to do. We need to show to Congress that they need to intervene. While we hope that CMS will do the right thing, there's not a lot of confidence that they will. As Kate mentioned, we've been advocating on this for a number of years, and we're now getting down to January 1st, 2022. And while we've made some baby steps with CMS, we really need them to be making large strides. And the question is, will they make those large strides to really mitigate this differential come November 2020, November of this year at least. Now, but we're not going to rely on just and hope for the best with CMS. We are pushing Congress to intervene because, again, we're making the case that CMS could make some of these changes via regulation. We've been advocating. We've had overwhelming response, but they're not listening. And that's why Congress needs to intervene. Congress, they don't want to intervene on CMS issues unless it's shown that they're not listening or they're not doing some common sense changes on some of these proposed regs. Now, in terms of what's going on up on Capitol Hill, folks may remember back this spring, we had a group of bipartisan members of the U.S. House who sent a letter to CMS saying, listen, as you put together this proposed rule, you really need to be looking at some of these issues, like the supervision issue, and include that in the proposed rule. Now, I will say that what's different this year versus previous years is that we've had a change in the administration. We have a new CMS administrator. We have a lot of new staff at CMS. And so the proposed rule was actually being written, was pretty much already baked when the new administration was coming in. So they didn't have a chance to put their fingerprints on it. So we actually have more opportunity this time around to make and influence the final rule versus previous years, because that's really when this new administration may actually make some changes. But again, we can't rely and hope for the best with CMS. And that's why in the spring, we asked Congress to begin that discussion with CMS with that bipartisan letter from the members of the House to CMS highlighting this issue. We also are working with our colleagues and friends over at the American Occupational Therapy Association, the National Association of Rehab Providers and Agencies, also known as NARA, and the National Association for the Support of Long-Term Care, NASAL. And folks may have seen back on August 2nd, the four groups sent a joint letter to Congress, again, highlighting the fact that we're not convinced CMS is going to make these last needed changes before 2022. And we really need Congress to start looking at legislation that would implement these three policy asks via legislation. Again, the three asks are delay for 1 year. And there's a lot of evidence and data to support a delay. Not only the fact that the final rule is not going to be published till November, and that gives practices and providers 6 weeks, I think at most, to get educated, to get health IT systems up and running. There's no way that's going to happen. Now, you combine with that the fact that we are still in a pandemic, and you look at the fact that therapy clinics have been hit the hardest when you look at spending by CMS during the pandemic, that therapy has been hit the hardest in terms of the impact of it. So we have small businesses, small therapy businesses that are still struggling. And compounded with that, we have additional cuts that are on the horizon that are scheduled for 2022. Again, CMS, in addition to this, wants to make other cuts to PT, OT, surgeons, physicians. We need a break. We need a 1 year delay because we want to continue to have this discussion about, is there better ways to do this? We had hoped to do that in 2020. We wanted to have that more thoughtful discussion, pragmatic discussion. But of course, the pandemic changed everything on Capitol Hill and CMS. So we're asking, and I think it's reasonable and logical to say, we want 1 more year to continue this discussion. The other issue, of course, is, there we are. The other issue, of course, is along with the delay, having a little bit of internet issue here in DC, is, of course, the exemption for rural and underserved areas, which Kate went over, and, of course, the supervision issue. This is something we've been advocating for years. But again, if they're going to implement this differential, one way they can provide flexibility to therapy businesses is to change the supervision. It just makes sense. 44 states allow for general supervision under the Practice Acts. The fact that Medicare has this more stringent requirement is kind of ridiculous. And also, quite frankly, I don't understand why they would want, there's no need to have direct supervision of physical therapist assistants and outpatient. Doesn't make sense. So we are building that message to Capitol Hill with that letter. And again, really beginning to educate and push members of Congress to intervene. That's something that I know federal affairs liaisons, Rachel, that the FALs are working on for their August recess with members of Congress. And we are working with our friends at AOTA and other groups on potential legislation that we hope will be introduced later this fall that would do just that. Again, but that means that we need to do two major pushes. One, right now, the immediate concerns, get those numbers up on comment letters to CMS. We've got to break the record on that. Show them, get on the record, and push them to do this. And then after Labor Day, you're going to start seeing things really start heating up on Capitol Hill in terms of legislation and pushing Congress to intervene to enact legislation that will mitigate both for the PTA and the OTA differential on those three policy asks. So a lot going on.
Like I said, you guys are always working on our behalf and doing a lot. There's a lot that we can do. So I'm glad that you kind of touched on what are some things we can do. Kate, do you want to remind people where they can go to submit the comment letters? We'll put that in the chat if we haven't already, and the deadline that is due. And then Justin, if you can do the same for congressional letters, reaching out to legislators, how do we do that? Not just members, but non-members, how can they access those avenues?
Yeah, so let me start off by saying that this matters. Your individual comment letter matters. CMS is required by law to read it. And last year, if it had not have been for our grassroots advocacy, we would not have succeeded in getting the 9% cut reduced down to 3%. So this has real impact, and you can actually make a huge difference. So we try to make it as easy as possible. We know you guys are busy. You've got day jobs. Use our resources. So if you go to apta.org and click Advocacy, then click Take Action, you'll have the Regulatory Action Center and the Patient Action Center. Regulatory Action Center is where you can find that really juicy PTA letter that goes into all the issues and really sticks it to CMS on this issue. Submit that to CMS. You can also submit the kitchen sink letter, as I call it, which covers every issue that we have in the fee schedule, including this one. So you'll be double dipping on the PTA issue when you're submitting comments to CMS. Tell your friends and family, tell your patients, tell your coworkers to go to the Patient Action Center, because that's for everybody to use. Don't have to be a member. Now that is sort of the kitchen sink letter, because we could really only load one thing. So we wanted to get as many people to use it as possible. So we put as many issues in there as possible. But like I said, it covers this issue. It covers the 3 asks, the delay, the rural and underserved, and the supervision issues. So let me make it clear that you don't have to be a PTA or an APTA member to submit comments. You don't have to be a medical professional to submit comments. If you pay taxes, your money funds this program, you have a right to say what the government does with your money and what they do with these public programs. So your mom can submit comments, your neighbor can submit comments, your cousin can submit comments. Tell everybody. Last year, I want to say we got around 20,000 comments. Right now, we've only got 1,000. It's early days. You've got till September 13th, but do it now. Because once we reach our goal of submitting comments, in which the comment period closes, you won't have the chance to talk to CMS. At that point, we will be switching our focus to Congress, and we will have some bills in the mix that Justin can talk about, and we will need you to come out again and do some more advocacy work, because it's never, it never ends. They're always trying to do something to us, right? But we've got to stay vigilant and we've got to stay active, right, Justin?
I tell you, it's 24 hours a day, 7 days a week, and never a dull moment. Yeah, and so I think, a way to look at this, it's a 2-phase strategy. For right now and for August, we need folks to focus on CMS. Let's get those letters in. Again, share with friends, neighbors, and colleagues. What's going to start happening right after Labor Day is that's when we do the big pivot, because Congress is in recess. They're gonna come back after Labor Day, and then that's when things are going to start cooking with Congress. Again, we're working on potential legislation that we want to get dropped. We also are going to be rolling out, just like we have a template letter to CMS on these cuts, we're going to have a template letter to Congress to say, you need to intervene. We're also going to have a new position paper, again, aimed at Congress, that you'll be able to share with friends, colleagues, and your member of Congress about this. I think that, another key piece to this, something that, again, it's on the website, we'll put it in the chat, and that is the joint letter that went to Congress from APTA, from AOTA, from NARA and NASAL, saying this is a problem, and you all need to focus on this when you come back from your recess, because this is going to be, it's going to impact rural care. It's going to impact small businesses. You're going to break up the PT-PTA team. We're better together. Why are you doing this right now? And you need to start making these changes via legislation, because we don't have trust that CMS is going to do the right thing come November. So we have a number of resources, a number of tools, a number of handouts that as we begin to our pivot to congressional action are going to be key. I do want to highlight, we're going to have 2 advocacy events that are going to echo and magnify this message to Congress. First, I believe we're going to look, stay tuned. It's going to probably be scheduled for August 31st. We're looking at that date, where we're going to have a virtual rally. And that's going to be a virtual rally to really get everyone to get comment letters into CMS. Now, second, of course, APTA, as part of our centennial celebration weekend, we are having our big APTA Advocacy Day on Capitol Hill, scheduled for Tuesday the 14th. The PTA differential is one of the priority issues we will be advocating on Tuesday the 13th here on Capitol Hill. So the hundreds of advocates that are coming to DC from across the country, this is one of the issues we're going to be bringing up to Capitol Hill, is the PTA differential. Now, if you can't come to DC, that's okay, because you're going to be able to do that virtually, online, through social media, as well as through our Action Center, different ways to engage, whether in person or online. And so, again, we have 2 strategies, one aimed at CMS, one at Congress, but we're going to try to get as many resources and tools to you to make it as easy as possible.
Thank you both so much for all that information. I do have a couple questions here. So there was a comment from PETA that said what she'd like to see is more information to the public. How is this information getting out to the public, to CMS users? I'm obviously like Medicare recipients need to know that this is happening, and a lot of them don't, and that's very true. So how is this information getting to them other than us telling them when we're treating them? Are they getting the information elsewhere?
No, that's a great point, because right now there's so much noise in Washington on so many issues, and there are so many cuts that we're dealing with under Medicare. It's the differential. We got fee schedule cuts. We have what's known as Medicare sequestration. It's really probably one of the most challenging times we've ever faced, and it's kind of scary, because how can we get this message out so that the general public knows about this? And so we're working on trying to get that message out here, and with both on Capitol Hill, with our consumer site. We're working on some additional resources on our choosept.com website, so that way consumers can get to know. We're trying to get the word out with press. But we also have resources. I would say one thing in terms of I think it is critical that folks do talk to their patients, and do talk to their friends, and do share these resources far and wide with anyone who is interested, because it's really going to be, we got to cut through the noise, and there's a lot of noise right now on so many issues. And so the more that each person can do and can get and recruit other folks to carry this message, again, sharing the resources that we have on the website, the social media that we're doing, that's going to help spread this message far and wide, not only to members and non-members, but to those consumers, to those folks who are Medicare recipients. And this is going to impact them. When we get right down to it, this is something that impacts patients, and that's who we care about. And we need to make sure that we get this out, along with that next generation of PTAs, the students. This is going to impact them. So making sure that we're not only engaging our current profession of folks who are licensed, but that new generation, and making sure that we're getting that information to them as well.
Yeah, I'll just add to that public awareness is really hard right now. If it's not about the vaccine, it's not making it onto any, headline. We've sent we've sent all these letters with members of Congress signed on, and it hasn't made much of a blip. So what we're really relying on this year is our grassroots advocacy. Just like you guys made a difference in submitting all those comment letters last year, we're calling on you again to let your patients know. Like Justin said, we're updating the Choose PT website. We've also got something in the works. We're going to create a one-page handout that you can print off and put in your clinic, maybe put it at your front desk, and it's going to have one of those QR codes, the ones that you scan with a phone, your camera on your phone, and then the website just pops up so your patients can scan, click, send a letter to CMS, send a letter to Congress later when it's time to do that. We're trying to make it as easy as possible for you guys to help spread the word. We're, of course, here on social media. We're doing whatever we can to, spread the word as well. But I just want to reiterate that we're kind of all in this together, and we've all got to do our own little part to fight this cut and get as many people involved as possible. And so, I'm preaching to the choir. If you guys showed up for the PTA Live, you're clearly tuned in and ready to advocate. So we thank you for your participation, and just hope that you can, spread the word around and let other folks know about what they can do.
We have another question that says, would the APTA reach out to the news? Like here in DC, NBC News 4, Fox 5, would that be something we would be doing?
Yeah, it's interesting. We are trying to push out to, it's not only the local media you see on television, but it's also it's what we call the policy press. These are the folks who write for those newspapers, and it's kind of inside DC, those communications that go around Capitol Hill, like Roll Call or what's known as The Hill or Inside Health Policy. And we're really also trying to focus there because those are the publications that Capitol Hill staffers read and that members of Congress read every night. And so we're not only trying to engage external PR with the typical, or we call traditional media, but also those media that we know policymakers, not only Capitol Hill staff, but folks who work at CMS. These are the publications that folks read. And there has been, we have had some success in getting some stories placed with some of those media outlets saying, on this very issue, talking about the letter and talking about, that this is a growing issue. I think one of the interesting things on this issue is that I think, first of all, I think physical therapy has a unique story to tell. And I think every single person watching has a unique story to tell because of where you work and who you work with and the impact of the pandemic that has had on you and your business, and what this will mean to you. And so I think individual stories are so critical because it really does put a face to what this this faceless policy. And so I think that is going to be critical. But I also think one of the things that makes physical therapy different in this situation, I mentioned, along with this, there's other fee schedule cuts. We've got this thing called sequestration we got to worry about. But when you look at the value that we want to bring to the healthcare system, we want to prevent downstream costs. We want to prevent hospital readmissions. We want to help out with the opioid crisis, and also play a role in COVID-19 long haulers. All of these things physical therapy does. We bring value to the healthcare system. We prevent downstream costs. We play critical roles in the two biggest public health emergencies that our country is facing right now, opioids and long haul COVID. And so it's just stunning, I think, and frustrating that out of all the professions, we're the ones who are dealing with this right now. And so I think that, as you, on the comment letters, there is a opportunity for you to share your personal story. And I think that's going to be critical too, is to share what this means to you, what this means to your patients, because everyone has a story that's going to be impactful to a member of Congress, to someone in the press, to someone at CMS, and that can make the difference. And so I think, again, physical therapy plays a critical role in our healthcare system now more than ever. And I think that means that we need to really demonstrate, this is an opportunity, it's a challenge. and it's a tough situation. But when faced with challenges, the physical therapy profession, we don't just sit back and take it. We stand up and we fight the cut, we fight the differential, and we do it together. And so I just want to reiterate that this is an opportunity. Although this is frustrating and a challenging time, this is also an opportunity for us, and we got to take it and fight back and push back hard.
So Brenda asks, when will that letter be available? And I can answer that question for you. It's already there. So if you go on to Kate has given us the advocacy.org website, and it should be in the chat. So you can go there and see the letter is already posted. And
let me jump in and say that, if you're a member and you go to apta.org/advocacy, and then you go to the Regulatory Action Center, that's where I said we've got the two letters, the one that the really punchy PTA one. When you click that, it gets downloaded. If you want to email that to people, you go ahead. We keep that Action Center private because it's a member benefit on most days. But if you want to send our template letter to your friends, feel free. We are not going to come after you for that. We want as many people to send the letter as possible. If you want to make it extra easy on them, just send them to the Patient Action Center, because that's the one that they can just kind of click, send. But feel free to share our resources because we create them so people will use them.
Yeah. And, Rachel, you and I, before we came on, we were talking about the Advocacy app, and something that is pretty quick and pretty easy to download, and something that everyone can go to either the Apple or Android store and download the APTA Advocacy app. And that's something that I know folks in Minnesota, your home state, has used a lot on your advocacy, and something that everyone else can use. And it's a great way to easily stay in contact with Congress.
Yes, I love the Action app. It's super easy. And I know Carolyn asked the question if there's standard language available to send to colleagues or consumers that explains the situation. And I know that is available not only on the Advocacy app, but also on the website. So you guys want to explain where they can find that information?
Yeah. So I think that the link is about to be posted in the comments, but we've got this whole page dedicated to the differential. It goes through what the issue is. It goes through why it matters. It goes through APTA's position, and it tells you what you can do about it. We try to give you bing, bang, bong, everything you need to get involved. Feel free to copy paste that as you email to folks to get them involved. But we did set up like a one-stop shop on this particular issue. This isn't even like the major fee schedule page. This is just about the differential. We also have a position paper, which is easy to print out. It's a two-sided thing that you can hand out to people. Maybe leave it, on your front desk next to the QR code handout so people know what they're talking about when they scan the code and click send. But it might be death by too many resources, but we're trying to give you anything you need to get people involved in advocating on this issue.
So for those that have questions outside of what we've talked about tonight, just advocacy in general, if they have a question about payer issues or anything like that, what can they access? Where can they reach you guys? Where can they get that information? Is there an easy way for them to reach you?
Again, we try to make it easy on you guys. Send us an email to advocacy@apta.org. That way your question will be triaged to the staff member who knows what they're talking about, depending on what your question is. If you've got a question about what a private payer is doing, we're going to send you to the insurer relations team. If you've got a question on regulatory stuff, if it's Congress, it might be Justin. So advocacy@apta.org is the best place to reach us. We check that email box constantly. So we try to get back to you very quickly with accurate information as soon as possible.
And, not only that, I was going to say, one of the things that I want to make sure we talk about is the survey that we just posted, that it's on the PTA caucus social media. And one of the things that we're looking for, if you go to this, is again, everyone has a unique story to tell and how this is going to potentially impact you and your patients. And so, as we look at ways that we can message this to members of Congress, your stories are important. And you'll see in this survey we talk about, tell us what's going to happen to you. What is the potential ramifications of this? And if you're okay with this, because we want your permission to send this, is if we know that someone, say, is in rural Arkansas and they have a story to tell, we can take that story to the Arkansas delegation and say, this is why the Arkansas members of Congress need to care about this. You have a PTA, outside of Little Rock, and they're saying they're going to have to close the clinic because of this differential. And again, whether you're in, Helena, Montana, or Sacramento, California, or Tampa, Florida, everyone has a story about how this is going to impact them, but their community. And by sharing that, and by able to connect, what we like to say, connect the dots for members of Congress. This isn't just a cerebral policy issue or a CMS regulation. In the end, this is going to impact small towns, rural communities, urban areas, and we need to be able to say to them, you've got 4 PTAs in Charleston, South Carolina, who are going to lose their jobs if you don't do something about this. And so that's why we have that survey on social media for folks to fill out and download, so that way we can start really connecting those stories with U.S. senators and with members of Congress to say, this is why you need to take action. It's not just because CMS isn't listening, but here are some folks that will really kind of paint a picture as to what's going to happen in your community, the folks you represent. You're going to have businesses going out of business. You're going to have patients who are going to be able to access care. You're going to have PTAs who are not going to be able to treat the folks that they need to treat. And so if you haven't checked it out already, please do so, and really tell your story, because that's going to really help us in terms of magnifying, amplifying, and showing members of Congress that this is serious. We're counting down. We're January 1st, 2022 is what, 5 months and how many ever days away. We got to get them to act, and to act before the end of this year.
Yeah, Justin, you make a very good point, and I know this is something you guys bring up all the time for us federal affairs liaisons. You guys are on Capitol Hill all the time meeting with these people, but really they want to hear from us. They want to hear from their constituents. So your voice as a constituent is much louder and makes much more of an impact than these wonderful people that are talking to you right now, that they do such a great job, but it's really those of us that are out there talking to our legislators and reaching out to CMS and telling our story, because that makes more of an impact. So thank you for saying that, Justin. That was very helpful. Does anyone have any other thoughts, any questions?
Well, Rachel, first I want to say thanks to you. As a federal affairs liaison for the PTA caucus, just the fabulous job that you do for the caucus, and being the FAL for federal affairs liaison for the PTA caucus. It's great working with you, and your passion for advocacy is hard to match. And so, just thank you to you. Thank you to the PTA caucus. This has been a great opportunity for us to collaborate and work together on this issue, which is incredibly frustrating. And that, as frustrating as it is, it's an opportunity for us to, carry our message and have an impact. And so I know that this is a tough issue, and we have tough times that we're dealing with right now too. And it's a challenging payment environment. And of all the things that we're dealing with, to have to deal with this as well. And it's tough. You look at all the other changes that have been happening in healthcare. This is another burden, another challenge that we're going to have to fight and to overcome. And this is where membership matters. This is where advocacy matters. This is where being, energized and part of the PTA caucus matters. Your advocacy, your work, and your passion on this issue is going to be critical for us to making a change and to really having a positive outcome. So, Rachel, thank you for all the work that you do. Thank you to all the folks who took time out of their evening to watch. And thanks to those folks who are members of APTA. Thank you for being members, and stay being members, and because membership matters and advocacy matters.
Yeah, I mean, Justin couldn't have said it better. Thank you for having us. Thank you, Rachel, for your commitment to this issue and just to representing PTAs. Anyone out there who's inspired by Rachel's work, join the Advocacy Network. Maybe sign up to be a key contact. We've got a lot of programs to get you involved if you want to take on a bigger role. Come join us for PT Day on Capitol Hill and go meet your member of Congress face to face and tell them what you think about this stuff. You don't have to. You can take whatever amount of advocacy you want to. We just ask that you do something, whether it's sending a letter or coming down to DC and demanding change. Anywhere in between is acceptable too. We just want you to get involved and help make your voice heard and help represent your profession. So thank you for taking the first step and watching this video.
Well, thank you to Justin and Kate. We really appreciate your time and giving us all the information that will help us lead this advocacy push to get the PTA pay differential fixed from where it stands right now. So thank you, everybody, for joining us tonight. We appreciate your time. Remember that there is a way to work on this issue right now. So go to apta.org/advocacy and submit your comments. Get out there and let your voice be heard. So thank you so much for joining us.